Welcome. Today, we're diving into the intricacies of a less commonly discussed, yet vitally important heart condition, coronary artery anomalies. These are abnormalities in the origin, course, or structure of the coronary arteries, the very vessels responsible for supplying blood to the heart muscle itself. While some individuals with these anomalies may live symptom-free, others can experience serious, even life-threatening complications. Understanding these anomalies is crucial for early detection, accurate diagnosis, and effective management. So, what causes coronary artery anomalies? The exact etiology remains somewhat complex and often unclear, but the vast majority are believed to be congenital, meaning they are present at birth. They arise during fetal development when the coronary arteries are forming. Genetic factors are suspected to play a role, and in some cases, anomalies can be associated with other congenital heart defects. However, for many individuals, the specific cause remains unknown. Rarely, acquired conditions or even surgical interventions can lead to the development of coronary artery anomalies later in life. To understand the consequences, we need to grasp the pathophysiology. Normally, the coronary arteries are rich from the aorta and branch out to deliver oxygen, rich blood to the heart muscle. Anomalies disrupt this efficient process. Aberrant origins, such as arising from the pulmonary artery instead of the aorta, can lead to inadequate blood flow to the heart. Abnormal courses, where the artery runs between the aorta and pulmonary artery, can become compressed during exercise, choking off blood supply. This ischemia, or lack of oxygen, can trigger chest pain, shortness of breath, and even sudden cardiac death. The severity of the anomaly and its impact on blood flow determine the extent of these pathophysiological consequences. Coronary artery anomalies are relatively rare, affecting an estimated 0.2% to 1.2% of the general population. However, their significance is amplified by their potential to cause sudden cardiac death, particularly in young athletes. They are one of the leading causes of sudden cardiac death in this population. While they can occur in individuals of all ages, genders, and ethnic backgrounds, certain anomalies may be slightly more prevalent in specific populations. Further research is continuously refining our understanding of the epidemiological landscape of these conditions. The signs and symptoms of coronary artery anomalies are highly variable. Some individuals may be completely asymptomatic, living their entire lives unaware of the anomaly. Others may experience symptoms that range from mild to severe. Common symptoms include chest pain or angina, particularly during exertion, shortness of breath, palpitations, dizziness or lightheadedness, and fainting or syncope. In the most severe cases, the first sign of a coronary artery anomaly can be sudden cardiac arrest or death. It's important to remember that these symptoms can also be indicative of other heart conditions, making accurate diagnosis paramount. Diagnosing coronary artery anomalies requires a combination of careful clinical evaluation and advanced imaging techniques. An electrocardiogram, or ECG, may show signs of ischemia, but it's often not definitive. A cardiography or ultrasound of the heart can provide some initial clues. However, the gold standard for diagnosis is typically coronary angiography, a procedure where contrast dye is injected into the coronary arteries, and X-rays are taken to visualize their structure and course. Computed tomography angiography, or CTA, and magnetic resonance angiography, or MRA, are non-invasive alternatives that also provide detailed images of the coronary arteries. Genetic testing may also be considered in some cases, especially when a family history of congenital heart disease is present. Coronary artery anomalies are classified based on the specific abnormality present. One key classification is based on the origin and course of the anomalous artery. This includes anomalies where a coronary artery arises from the pulmonary artery and L-Pi, or from the opposite sinus of Valsalva. The course of the artery is also important, for example whether it passes between the aorta and pulmonary artery, an interarterial course, or within the heart muscles, intramural. Other types include single coronary artery, coronary artery fistulas, and coronary artery atresia or stenosis. Each type has a different risk profile and may require different management strategies. Treatment and management strategies for coronary artery anomalies vary depending on the type and severity of the anomaly, as well as the presence of symptoms. Asymptomatic individuals with low-risk anomalies may only require regular monitoring. However, symptomatic individuals, or those with high-risk anomalies, usually require intervention. Surgical correction is often the preferred approach, involving reimplantation of the anomalous artery to its correct location, or creating a bypass graft to circumvent the anomaly. In some cases, less invasive percutaneous interventions such as stenting may be an option. Medications such as beta blockers may be used to manage symptoms and reduce the risk of complications. Lifestyle modifications, such as avoiding strenuous exercise, may also be recommended. Unfortunately, because most coronary artery anomalies are congenital, There is currently no known way to prevent them from occurring. However, early detection and management can help prevent serious complications. Genetic counseling may be considered for families with a history of congenital heart disease. Promoting overall heart health through a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, is always beneficial, even if it doesn't directly prevent the anomaly itself. The prognosis for individuals with coronary artery anomalies varies widely depending on the specific anomaly, the presence of symptoms, and the effectiveness of treatment. Early diagnosis and appropriate management can significantly improve outcomes. Recent research is focused on improving diagnostic accuracy, developing less invasive treatment options, and identifying genetic markers that may help predict the risk of developing these anomalies. For example, advances in cardiac imaging are allowing for more detailed visualization of the coronary arteries, leading to earlier detection. Ongoing research is also exploring the long-term outcomes of different treatment strategies, helping to refine clinical guidelines and improve patient care.